Doctors are starting to see a spike in spinal cord injuries during the summer months. Most people are out and about and traveling by boat and car, and with that comes an increase in accidents. Dr. Roger Parthasararthy with the Seton Brain and Spine Institute is here with more on these spinal cord injuries. Thank you for joining us, doctor.
Thank you for having me.
Okay, so let's talk about this. What's happening in the summer where we're seeing a spike in spinal cord injuries?
Right. So historically, there's always a relative uptick in the incidence of spinal cord injuries in the summer, largely because more people are engaging in recreational activities, boating, water skiing, diving, swimming, and also more people are on the road. So when more people are on the road, that's going to increase the chance of accidents occurring. And actually, motor vehicle accidents is the #1 cause for spinal cord injuries.
I could only imagine what that means for Austin's numbers, considering that we've had a spike of people living here now and more people on the roads as well.
Yeah. In fact, traditionally, we usually see a few people every summer that get injured as a result of swimming accidents, diving accidents, but we've really not seen that in the last year and a half to 2 years. It's a bit unusual, but we are seeing an increase in people with spinal cord injuries sustained as a result of motor vehicle collisions.
You were telling me that most people, contrary to popular belief, most people can recover from spinal cord injuries.
Well, most people recover to some degree. In terms of recovering completely, there are some people that can achieve that. It all depends on the severity and location of the injury, those sorts of things, but everyone recovers some function.
Okay,
compared to initially.
And then you mentioned the swimming and the diving, the brain floods. They change our lake levels. How does that impact to this?
Right. So, a lot of times, spinal cord injuries tend to occur to people who are younger, typically younger than 30. Usually in their teens or early 20s. And so you have individuals that are courageous and fearless, and nothing happens to them, so they dive in without thinking twice about it. And when you are diving in to natural water, you don't know what the topography is underneath, and with the amount of rains and flooding that we have had, that topography can change. Even though you've been diving there for many years, it may be different now, and unless you really check it before you go head first, you may not know.
I see. So those younger people are much more daring. And then switching gears, you have a new treatment over at Seton that's kind of giving a new lease on life to patients.
Well, yeah, we have a very unique brain and spine recovery center that's sponsored through Lone Star Paralysis Foundation and Seton, and we employ a lot of innovative techniques and technologies. For instance, one of the therapists I work with, Eric Lance, is starting an upper extremity recovery group where he is challenging patients to work out kind of in a rotational fashion on various pieces of upper extremity equipment to kind of maximize upper extremity function and return. We're also working with another researcher, robotics engineer professor.
And that's what we have here, right? That's what we're seeing.
Yes, at University of Texas. That's the Harmony robot developed by Ashish Deshpande.
What does it do?
It's basically, it was designed as a therapy robot, and it is designed as a piece of apparatus to help people achieve range of motion, strength, enhanced function. So we're just starting to apply this to normal individuals, and we'll subsequently be applying that to patients with spinal cord injuries and strokes.
I see. And so how it helps also too is that those muscles don't atrophy, and they can kind of keep active to some degree.
Right.
All right. All right. Dr. Roger Parthasararthy.
Perfect.
Thank you for joining us.
Thank you for having me.
Keep up the good work over there.
Thank you.
All right.